Hi, it's Dr. Craig Brown of the Holistic Health Social Network, and we're going to continue talking about expansive medicine today. I'm going to stay with the mouth for a little bit longer. I want to talk to you about some signs and symptoms of oral pathology. These signs and symptoms of oral pathology, in my mind, suggest a compromised immune system. There are different levels of compromised immune systems, of course. I'm talking about the incipient stages of compromised immune systems. And as I said earlier, if we catch the problem at the early enough stage, it's easier for us to wipe it out before it gets to a level where we can't, or it makes it too difficult. So, what are some signs of oral pathology leading to systemic problems or systemic compromised immune systems? Bleeding gums, as I said, bleeding when brushing, and that could be a sign of future heart disease. It could be a sign of bone loss, future bone loss, or osteoporosis. It could be a sign of future dental disease, as bone loss, loose teeth, or having to extract teeth, which, as we spoke about earlier, creates an additional problem, because when you start losing your teeth, even if it's one at a time, this very important mastication we were talking about, we're not able to achieve it properly. So now, because you're missing a tooth here, a tooth there, or not the exact tooth that you had before, that God gave us, which was the perfect machine, and we try to mimic it as best we can. And dentistry does a good job of that as well. But we're not going to be getting those important enzymes that our body needs to make energy for ourselves and to keep our immune system strong, to power the machine. I mean, you're not going to have as good gas in the engine, in the car engine. You're not going to have as high premium gas in the car engine as you would have. So oral pathology is something that we really have to keep an eye on for early stages. We have to look for sores. Some sores in the mouth, little white dots people get in the mouth when their immune system is compromised. It's called RAS. It's recurrent abscess ulcers. And this is a sign that our immune system is a little bit compromised. It could be just for a moment. We could be getting a flu. But something is pulling our immune system down. And what we say in mainstream medicine is, oh, it's microorganisms, it's bacteria, it's viruses. And I'm not in total disagreement with that. But what I truly believe is it's not really that. That is a secondary factor. This is very important, very, very important. The primary factor in my mind, how I address this, is that your body's acidic. And because it's acidic, it's allowing this proliferation of these microorganisms that we talk about so much in mainstream medicine. So I go before that. What feeds these? What's drawing them into our system, where they can proliferate, where they can live? What's making them happy? Why are they there? They're there to be in the civic media. And our whole society, everything you watch on television, everything you drive past, every billboard on the street, every 80% of the restaurants, 99% of the restaurants out there are all advertising, hey, let's be acidic, let's have fun. Let's have fun and be acidic. And they make it very enticing. It's almost like being on a not to say drug, but I mean, how many people do you know that are addicted to sugar? Sugars and ketchup? Somebody loves ketchup because it really tastes the sugar. So there's a lot of addictive foods that are acidic. And they're not only addictive to us, they're addictive to microorganisms. It's good for them, it's bad for us. So it's like a vicious cycle. The more that we eat these acid-forming, acid-producing foods, or so-called foods, I don't consider sugar food, the more microorganisms are able to grow, proliferate, populate, and basically live in our bodies. So, what we want to do is obviously become alkaline. We want to decrease toxicity. We want to decrease the amount of time that food needs to be digested in our bodies. So we have more energy to feel alive. I've seen so many people who have what they call chronic fatigue. Don't ask me for the definition of chronic fatigue, because I don't think anybody really knows what or where it's from. But in my opinion, it's from in many cases, not all cases, but many cases, it's a misuse of ATP, or the energy that our body makes. It's misguided. It's going to the wrong place. It's going to a place where it really shouldn't have to, but we're forcing it. So the blame is on us. The blame is not on the television, it's not on the advertisers, it's not on the foods out there. We know where to get the good foods, we know how to eat the good foods, the blame is on us. It's how much you want to be dependent on keeping your body acidic. And you have to know down the line it's going to catch up to you. So, as I said, I slowly bring people through stages, and they enjoy every step of it, because I enjoy and love every meal I eat now more than I did before. When I had the heavy desserts, and I had the heavy protein meals, and I mixed protein with carbohydrates, and they'd be exhausted. I was totally exhausted for 2 or 3 hours, and so are you. So we're going to talk about that at a later date. So with the knowledge that I'm going to give you, you're going to have more energy, we're going to increase your immune system, we're going to try to keep you away from down the line, down the road, of the disease process, which brings us into that middle part of what we talk about, expansive medicine, middle part of our rubber band, which is mainstream medicine, which is diagnosis, testing, diagnosis, treatment with prescription drugs, which sometimes have other harmful effects. If you read the adverse reactions or side effects on drugs, what are those? What are they actually doing? Are they actually just giving you a little cramp in your leg? Why are you getting a cramp in your leg? We're going to discuss all that. But we want to stay away from that. We want to jump all the way to living good and living for the cure. And longevity and rejuvenation and extra energy and becoming younger, to me, is the cure of life. That's the answer to life. When you read the Bible, the first people in the Bible lived to be 550 years old, whether you believe that or not. The Huns, the tribe, they live a lot longer than we. They're on record, it says India and Pakistan, they're on record for living to be 120, 150. In fact, they even talk about women were having babies at 120 years old. So something is Hunza, and an interesting Google. And this is where I'd like to take it. And it's about a quality of life. It's not about being older. It's not about living like you're 80 years old for an extra 20, 30, or 40 years old. I'm saying 80 or 90 year old, what people think that is. It's about being 25 or 40. It's about being 35 or 50 or 55. It's about being 40 at 60, 65. Not only feeling it, but looking it, and having the energy levels of it, and enjoying life like you did 15, 20 years before that. And we can do that. It's being done. You just haven't seen it. But we're not going to be hiding from it. So, as I said, in the mouth, recurrent abscess ulcers, canker sores, that's one of the signs of syphilis. Thrush, which is candida in the mouth. Bad breath, body odor. Bad breath, is caused by a lot of different things we think. We know it's caused by the byproducts of microorganisms, by the fermentation of food from the stomach. These are all things that I address and I talk about, and we can get rid of bad breath. We can get rid of bad breath as we get closer and closer to, I haven't mentioned this yet, the place, in quotes, and you'll see it on the website. The place is, when we start approaching the place, the end goal of the place is literally taking all my 6 or 7 or 8 points of my system and being younger, getting healthy, and retaining that health for our whole life. And you're going to be living happier, stronger, a better quality of life, and less aches and no aches and pains, less aches and pains of old age. I mean, it's a great place to be. It's a great place to be, and that's what we all strive for. And we're not trying to do it overnight. No one's going to push anybody to do it overnight. I would recommend doing it overnight if you have a terminal disease, if you're diagnosed with something that really needs to be addressed immediately. But it is a process. It's a fun process. So that's what I want to walk you through. I want to walk through the fun process. I want you to enjoy it like I did. I want you to get to the place. Eventually get to the place.